Thank you for the opportunity to present today. I have no financial disclosures. So COVID-19 posed an unprecedented threat to our modern healthcare system, and bariatric surgery utilization was severely limited. The extent to which the pandemic may have reduced access to bariatric surgery remains unknown. We sought to quantify how the pandemic affected bariatric surgical volume, and if this varied by race. Was there a shift from inpatient to outpatient bariatric surgeries during the pandemic? And was there an increased 30-day readmissions? We analyzed the Premier Healthcare Database, a large, diverse hospital administrative database, and found 309 hospitals performing bariatric surgery with continuous monthly data submissions from January 2019 to 2021 in June. We used hospital fixed effects approach to allow each hospital to serve as its own control. Further methods are shown here. And in 2019, there were about 46,000 bariatric procedures, which underwent a 14% reduction in 2020. There was a pronounced decrease in 2020 in April of 89%, in May of 55%. Another decline was seen in November 2020, coinciding to the third wave of the pandemic. In February of 2021, volume was almost equal, and in subsequent months, there were relative increases of escalating magnitude. So bariatric procedures for all races decreased dramatically in April of 2019. However, instead of reduced access for minority patients, we found that on average, there were a greater proportional increase in bariatric surgery performed in minority patients after the first wave of the pandemic. We noted that for sleeve gastrectomy, there were no clinically significant transitions from inpatient to outpatient surgeries, or for gastric bypass. There were no differences in 30-day readmissions rates, with a rate of around 3%, except during the lockdown period. So bariatric surgery volume decreased by 16% overall in response to the COVID-19 pandemic. There was a higher rate of utilization by minority patients after resumption of bariatric procedures, and there were no shifts in procedures from inpatient to outpatient surgeries, despite pressures from insurance companies, or in readmission rates pre- and post-pandemic. But a full consistent return to normal was not seen until nearly 2 years after the start of the pandemic. So our findings indicate that prolonged consequences on the healthcare system and on patients awaiting bariatric surgery. So delaying bariatric surgery could certainly have untoward consequences of progression of disease for obese individuals. Thank you very much for your time today.